Hey everyone, welcome to Pain to Par, YouTube channel where we turn physical setbacks into comebacks so you can get back to doing what you love. For me, that's golf. So in today's video, I'm going to be providing you a quick update on the intensive 12-week program that I've just started to heal my degenerative disc disease, relieve sciatic pain, and hopefully make a dent in the recovery of my hip arthritis. So let's get stuck in. Okay, so let's start with the program itself. It's an intensive 12-week program. In the first 4 weeks, I'll be doing the robotic laser decompression, or what I'll call RLD, 3 times a week. Those are about 20-minute sessions. And I will meet with the physiotherapist to do neuromuscular re-education, really just a set of exercises that are targeted to help with mobility and strength in the lower back and the pelvic area. So including the glutes, the quads, hamstrings, lower back, thoracic back. So it's a good routine. In month 2, that will taper down to twice a week for the RLD sessions, and I'll meet with physiotherapists once to fine tune and refine. And then in month 3, down to 1 time per week for the RLD, and I'll meet with the physiotherapist once. Wrapped around all of this is weekly consultations with Dr. Zielonka. So that could include chiropractic adjustments or some other form of treatment, depending on what he deems is necessary to keep the progress going. And as a foundational component to this program, there is I take a really just a joint healthy supplement that's prescribed by the doctor. It's included in the program, so it's really just it's all taken care of for you. So it's great. So let's talk about progress to date. So today, this was week 1 of 12, right? So it's the end of week 1. I had the RLD sessions 3 times this week. I met with the physiotherapist once to go over the exercises, and I was at the gym. I did those exercises at the gym, so I was in the gym 4 times this week, doing those stretches. Stretches take about probably 30 minutes or so, and the rest of the time is really just walking on the treadmill, trying to get about 5 to 10,000 steps just to keep the hip joint lubricated. So, yeah. So let's talk about progress. As I think about progress, I'm looking at 3 main components of my own healing. I have really bad sciatic pain that when it comes on, it really hurts and doesn't go away easily. Hip pain, right? I have hip osteoarthritis, so any relief I can get in the hip, whether that means that allows me to increase my range of motion or just decrease pain, is a good thing. And then I have lower back pain, which probably is a result of the hip arthritis and probably some problems with my pelvis and my hips that are causing my lower back to pick up more of the stress, and which has contributed to the degenerative disc disease. So, like I said in the first video, I really feel that the RLD sessions are a critical part of this healing, in that I want to rehydrate the discs, get them feeling better, which should reduce the sciatic pain and could potentially help with the hip pain through the exercises and the additional adjustments that I'm going to be doing with Dr. Zielonka to get my hips back aligned and balanced. So as of this week, in general, my sciatic pain is, I'm still experiencing it probably 1 to 2 times a day, and it's painful. But it doesn't last too long. But I have a story for that. The hip pain, generally speaking, the range of motion's pretty good, but my external rotation of the left hip is really significantly limited. So that's one thing I'm going to be monitoring. And my lower back pain, I can't touch my toes right now, and really, it's anytime I twist, like turn left or right, it's really tight. So focused on trying to strengthen the lower back and stretch out the QL bands. So given that this is week 1, I'm setting the progress as really no change because it's the basis. And in general, the RLD sessions, those robotic laser decompression sessions, have been pretty good. So I'll show you what that looks like right now, and as I took a video of me in the on the table. So this is the machine. It's pretty cool. That's where the class 4 laser blasts your back. Okay, so I'm on the table, as you can see, on the laser, trying to, that's the laser decompression table. Sorry, kind of moving it around, but trying to get you a shot. I'm strapped in. There's a laser beaming on my back right now, and I've been pulled apart. So far, so good. Thanks. Okay, so there you go. Yeah, first person video, right? It was cool. It's very comfortable bed. They do strap you in really tight because it's essentially trying to pull, decompress your back. So it does require it to be tight fitting. But, and you can feel being pulled apart and you can feel the laser on you. But overall, it was a great experience, really relaxing, not painful at all. And in general, like I said, it should take up to about 8 sessions before it could start to see any impact. However, I will say this: I did notice something today, which is after number 3. Yesterday, it snowed in Ottawa, and we got a fair amount of snow, easily like several inches of snow, and it was wet and sticky snow. I went out to try to shovel it, and somehow through that process, I just tweaked my hip. Something moved the wrong way. I don't know, but my hip hurt and the sciatic kicked in and did not, like, that was around 4 o'clock. And by 8 o'clock, I was still like, I had tried different positions, different stretches. Just nothing was working. So I decided I'll just go to bed and hope to sleep it off. Luckily, I did fall asleep, and it didn't keep me up, which is great. But I woke up this morning; it was still hurting. Maybe not as bad, but it wasn't. I was still feeling it, and it was impacting the way I was walking. I was kind of walking a little weird. But I did. First thing this morning, I had a RLD session, so I went into the clinic, did the session, and then I had to run a few errands, and I came home. And it wasn't until I got home that I was like, "Hey, wait a minute! Like, my sciatic's gone." And I remember, and then I start rewinding, and I'm like, "Well, wait a minute! When I left, I didn't walk weird. I actually, I had to go to the store, and I didn't find like my leg was hurting. So that was really cool because nothing was working last night, and it was still painful this morning again. And after that session, it was like I realized that, holy crap, man, it's gone. So we'll see what happens. Obviously, like I said, this is a 12-week process. So and the body just doesn't heal that quickly. So, but I'll take it. I think anyone who has sciatic pain will take any type of relief they can get, and I'm trying to do it without a lot of medical meds. So yeah, anything I can do naturally is great. So that's it for now. I will be providing a update next week at the end of the week, unless something really interesting happens, then I'll do another video. But if you want to continue to follow me on this journey, hit the subscribe button, smash that bell button, and I'll see you in the next video.